The problem we were presented with was preventing low back pain and injuries in new first-time mothers. The group included Austin, Cecily, Jacqueline, Katie, and Timothy. During pregnancy, women experience many changes to their bodies that can affect their everyday lives. Lower back pain is common for women, not only when they are pregnant, but during postpartum as well. One of the main causes of low back pain is due to posture and weak posterior chain muscle groups. Many doctors recommend different strategies to eliminate back pain, such as practicing good posture, exercising, and using proper lifting mechanics. Because this is such a common problem for so many women, we believe that our audience will respond well to our proposed interventions. The planning process involves finding a time to offer a class, finding people to take the class, and finding exercises that are both beneficial and not too physically demanding for new first-time mothers. The class could be held virtually or in person. Having the class held virtually could be useful for finding a time that is convenient for participants. Offering multiple levels of exercises and stretches can help keep the participants within their own comfort zone when performing them at home. We followed the social cognitive theory. The social cognitive theory stresses direct observational learning and instructional learning, and we thought that this information would best be presented in class format. In this class, we will teach women exercises, stretches, and how to modify their everyday activities to prevent injuring themselves and to reduce their pain. For the implementation of this, we would create a class that could be presented in an auditorium or large group setting. We could create an online sign-up that could be easily shared and sent to chiropractors in the area. The chiropractors could share the sign-up with patients or mention it on their websites if desired or even possible. This would allow us to reach a large population of first-time mothers with low back pain. We could also share it on the school website in order to raise awareness in our school setting. We would, at that point, reserve an auditorium in the school in order to do our class. To offer this virtually, we would simply have to set up a stream of the class, which could be done using streaming services such as Teams, Skype, or Zoom. Whenever you have a class, one concern is always trying to find enough people to attend, especially when the target audience is so exclusive. The challenge of finding enough space for a class to take place wouldn't be a problem if many of the participants were online. COVID-19 has increased the knowledge of many people on how to do business online. The only way to measure whether or not the intervention was successful or not is simply ask the patient. There is no real way to objectively measure pain from person to person, but each person can measure and evaluate their own pain. We can deliver a survey/questionnaire to the participants at the presentation and then a couple of months after the presentation to see how the women responded to the intervention. There isn't anything to compare to. However, the ease of following the intervention and the back pain itself can be quantified on the questionnaire. Level of ease, sticking to what was taught in the presentation, can also deem the intervention successful. This is a problem that many women have struggled with. After going through with all the changes that pregnancy comes with, many women need a break from the stress. It can be stressful for a person to be unable to go about their day as normal because of pain. We are hoping that with the exercises and stretches that are offered in the class, there will be a reduction of the extra stress that comes with low back pain. There is always room for improvement to be made in pregnancy and postpartum pain management.